Hi, everyone. This is Shanna Miranti from Naples, Florida, and I am joined by one of my favorite dermatologists in the acne world, Dr. Hilary Baldwin. She and I will be discussing grand rounds in acne, and I will be picking her brain in the case series, What Would You Do? My first case is a 20-year-old Hispanic male with a 6-year history of acne vulgaris. He started breaking out in his early teens and completed a 5-month course of isotretinoin at age 15, but then started to experience a recurrence around age 19. The patient's currently a college student. He does not want to go back on isotretinoin because he does admit to having some fun at some SEC football games. So he does not want to go back onto isotretinoin and just doesn't want to go through all of the lab work or follow-ups or what have you. So he wanted an easier regimen. So with this case, how would you proceed? What would you do? He's starting to get some acne back.
You opened so many cans of worms here. First of all, we know that when you treat with isotretinoin below the age of 16, for some reason, the witching moment is age 16, the chances of recurrence are actually pretty good. So we're not surprised that he's recurring here at 19. He looks as if he's got some scars. He might very well need isotretinoin again, perhaps when he comes back during the school break or whatever. The second can of worms is what drives me absolutely nuts, is the kids who refuse to go on isotretinoin because they want to drink.
Right.
Um, it's a problem. And and even if they don't admit it, you know that it's going to happen. So I would love to talk about this at some point. Because there is no guidance, there is no answer. I personally tell them, if you know you're going to drink, like there's a party that weekend, don't take your isotretinoin that day or even the day after. If you have a hangover, wait until the hangover is gone, and don't take Tylenol for your hangover, right?
Right.
Um, and that I would rather see them have a beer every day of the week than have 7 beers on Saturday. So
Right.
that's what I say to them, because sometimes, sometimes they have acne worse than this and they're scarring. And mom is just sitting there while the kid says, no, I don't want to be on isotretinoin because I want to be able to drink. And she doesn't say a word. Like,
Right.
this is crazy. You're scarring and you're going to have scars for the rest of your life. So you can have a couple of beers. It's a soapbox issue for me, obviously, and I will stop now. But I think to keep things super simple, I would go with the triple combo again. It's very effective. It works rapidly, and I think he'll see some good signs of improvement. And we want him to be better as fast as possible because it's hard to be in college with this kind of appearance. So that's where I would go with this.
Yeah,
Uh,
very, very good. So that's kind of the same way that I was thinking. I wanted to keep it simple. He did complain about oily skin, and it's interesting. I
oh,
often find the young men that went on Accutane, early and got all dried up and didn't have the greasy hair for a number of years in their teenage years. They get very bothered by the sebum
yes.
when it returns. And we know that there are not many products out there that address excess sebum production. Of course, isotretinoin is one of them.
Right.
But we only have two more. And rumor has it, Dr. Baldwin, that there's only one topical that addresses excess sebum production. Only one. And if
So
you ask
you threw
TikTok, they
in,
might say, is it benzoyl peroxide?
no,
Is it topical retinoid?
no,
No. What is it? Tell us
it
all about
is
that, Shanna.
Clascoterone.
That's
Clascoterone has
exactly
been
right.
shown to reduce sebum production, but also to reduce oiliness and facial shine. Now, those are two separate things. I didn't know that. Facial shine is actually seeing shine from across the room, right? Really shiny skin. And oiliness is more of a tactile sensation, that horrible feeling that you get at the end of a hot summer day. Where you're like, ugh, gross. So it's more of a T-zone oily issue. Both of them were shown to be reduced. In fact, also pore size uh, by the use of Clascoterone twice a day, and that was just with the 12-week data. So this
Right.
is a 52 weeks ongoing study, and they showed us the 12-week data not too long ago, and you see a 27% reduction in sebum, which is huge for these patients. And as you mentioned, once they got used to not having pimples and not being greasy, having to go back to that is harder than having had it to begin with.
It's so, so tough. And you brought up a great point. I always make sure I counsel my young males when we do see scarring acne at 14, 15, under 16 years of age, that there is a very good chance that this acne will recur. They have a lot more hormonal development to go. They've got a
Yes,
lot more testosterone to burn, and
that's
it
right.
could come back. And so
Yep,
can the acne, so can the sebum. So we need to have some great options for these males. I think we think of hormonal acne as just a female thing because it was marketed as female hormonal acne, but the young men really do, suffer from a lot of these, hormonal side effects, and all acne is hormonal. So
exactly.
we
That's
need to
why I hate that
remember.
term. We have to come up with another term instead of hormonal acne. I mean, what we're really talking about is adult female acne when we say hormonal acne, I think.
Right,
So
right.
let's call it adult female acne and stop pretending that all acne is not hormonal. It also implies that clascoterone would not be useful in a male patient. And it is, in the
It
clinical
works.
trials, 38% of the patients were male.
Yeah.
So as effective as in guys as it is in women, as effective in adolescents as it is in adults. So, there is there's no niche patient necessarily because it's appropriate for all of the patients who come in with acne.
That's so true. And that's such a great point. We can use it for the young, we can use it for the old, we can use it for the males, we can use it for the females. Any patient over 12 years of age,
Right.
it will work great. So this young male had a great outcome. I did start him additionally on Clascoterone, and that helped him tolerate the triple
Yes.
combination. We had a little bit of a tolerability issue at first. He was not able to tolerate it every day. He could only use it maybe 3 times a week or 4 times a week because I believe he wasn't properly moisturizing, but that's another story. But adding Clascoterone BID in addition to the triple combination at nighttime, on top of it, QHS, really reduced his sebum production, and the patient was thrilled that he didn't have to go back on isotretinoin.
Great results. My turn. A 28-year-old woman who is on spironolactone 50 milligrams, doing really well, virtually under full control with no side effects. Why would we be talking about her? Because she comes in and she says, you know what? I'm thinking about having a baby. And I know that I can't be on spironolactone when I'm pregnant. So what's a girl to do in this situation? We, of course, have very limited possibilities because she will be pregnant in the near future. I mean, most of the acne medications that we use are fine up until the very last, the moment that she becomes pregnant and for several weeks to months after that. But what's the point in starting her on something new now that she can't continue through her pregnancy? So what
Right.
would you do?
So great, great case because this is definitely real world. This is something we see all the time. I typically tell patients, look, stay on your topicals until you get that positive pregnancy test. Do you do the same thing or do you have them
Yes.
stop weeks ahead when they're trying, so to speak?
No, the only drug that I really think needs to be stopped before that point is isotretinoin.
Of course. Yeah, of course.
Everything
So
else,
Absolutely. But if she was very worried about being on spironolactone, I would certainly consider taking her off of the spironolactone and starting a topical androgen receptor
right?
inhibitor, clascoterone, and then continuing on a retinoid that she, again, could topically use up until the point when she actually gets that positive test. I hope she, hits it out of the park and gets pregnant right away. But the reality is, it's tough to get pregnant. And just because you
Yes.
miraculously change your mind and decide it's time to start conceiving, it doesn't always happen right away. So I want the females to continue their topical therapy until they get that first test.
Yep.
So I like clascoterone BID for her. I would also consider a topical retinoid. And of course, we have azelaic acid, which has been used anecdotally in pregnancy for years. And that's what I typically use for my pregnant patients. Most providers consider adapalene a pretty safe option as well. But I'm really excited to hear what you did here.
Well, I told her, as you suggested, to go ahead and start with Clascoterone. I'm fine with her continuing spironolactone up until the moment that her pregnancy is confirmed.
Same.
Because we know that the reason why spironolactone is contraindicated in pregnancy is because of the possibility of testicular feminization, which happens several months into pregnancy. So
Right.
I'm okay with her staying on it. To your point, she's 28. She may not get pregnant right away. Keep her on it until such time as she needs to stop, but introduce the clascoterone now so that if she gets lucky and she gets pregnant right away, she's got something else on board. I didn't go with the topical retinoid. I agree with you. I'm not medically concerned about the use of retinoids during pregnancy, frankly. But medical legally scares the daylights out of me. Same thing for spironolactone. Your point, which is that since she's worried about it, we
Hmm.
should stop it, I think is very well taken. Because the bottom line is there is no data whatsoever that says that spironolactone has ever caused testicular feminization. It's a concept, it's a theoretical, but it has never been reported. And this drug has been out since 1957.
You would think we
But,
would have some data on that by now,
right.
wouldn't you? Yeah.
But, unfortunately in the US, about 3% of pregnancies have untoward outcomes. So, you know, if that happens, I'm absolutely sure I'm going to get blamed for it. So your point is very well taken.
And as we're talking about theoreticals, what about the theoretical concept of using topical spironolactone? I know how you feel about that, but why don't you tell us your thoughts on topical
Well,
compounded
at the present
spironolactone?
moment, the only way to get topical spironolactone is to have it compounded. And my problem with that is, well, I have a problem with compounding anyway, because, there's no data. The only thing that the company has to be able to demonstrate is that what they say is in the bottle is in the bottle, but there's no studies on it. It, Huge pharmaceutical companies have tried to manufacture topical spironolactone without success. And you think the guy down the street who compounds miraculously figured out how to do it? I don't buy it. I don't think topical spironolactone exists right now, and clascoterone is the way to go.
I'm with you
Other
on that one.
soapbox issue.
Well, this was so much fun going through some cases with you today. Like I said, I could talk with you about acne for hours and hours, but we have run out of time. So thank you, Dr. Hilary Baldwin. This is
My
Shanna Rianti from
pleasure.
Naples, Florida, and it was so wonderful discussing acne with you today. Stay tuned for another episode of Grand Rounds.